Okay, to the next video. So, moving on to the next part of the presentation. Um, so, m- Describing what is risk. So, we talked about a little bit about what the hazards were, um, potential to cause harm, um, and then risk. Will that circumstance um, cause harm? And then if you look at this kind of like circular diagram of hazard, exposure, risk, and vulnerability, and how risk falls like kind of like in the intersection of those circles. So it's a combination of um, three factors. So risk at a minimum incorporates probability and severity of an adverse event. Risk assessment is a systematic process of analyzing info to determine if hazards may cause harm. Fundamentally descriptive, but not to recommend any particular decision, but to inform decision making. So here's kind of a decision, or not decision, here's a kind of a flow diagram of the risk assessment tool. The last one, some people include it in or not, but mainly it's definitely the first four. And then I guess the risk assessment informs what the control measures will be. And we'll talk about that at the end of the presentation. So first part of the risk assessment is the hazard identification, which identifies sources of harm. The second is dose response assessment, how much may impact the worker's body or person's body. Um, Number three is exposure assessment, health effects of measured exposure. Number four, risk characterization, likelihood of exposure X to and severity of harm. And then the last is when going to the control measure, applying a control and review residual risk. So risk assessment um, starts off with planning and scoping of the hazard identification, what the health problems are caused. So if it's like a pollutant or another exposure, then there's a dose response assessment. Um, what are the health problems at different exposures? The exposure assessment, how much of the pollutant or chemical or whatever exposure that you're looking at um, is exposed to during a certain amount of a specific time period, and then how many people were exposed, and then the risk characterization. What is the extra risk of health problems in that exposed population? So, with some of these steps, like the dose response assessment and the exposure assessment, they'll be covered more in depth in the toxicology lecture. So, I'm not going to go too far into it, but there'll be some terms that you'll hear today that you'll hear in the toxicology section or toxicology lecture. So hazard identification is the first step, and it consists in collecting data from different sources to determine whether substance or exposure is toxic. Can that exposure result in an adverse health outcome? So data sources are mostly experimental, so structure activity relationship, in vitro and in vivo animal bioassays and experimental, for example, and then observational could include human epidemiological studies and then human versus animal studies. So some um, kind of like a chart for human versus animal studies. Um, you can see that human studies are often not possible to conduct, and then we can usually do those experimental kind of things in animal, and they're usually possible. Can we obtain the information before human exposure? In animals, we can, but in humans, we can't. Is there a time requirement after exposure? So that can be years to decades. And animals, we can have a much faster decision or faster time to exposure, weeks to years. Species of interest, obviously in humans, yes, but in animals, not really. Um, Cause effect determination, it's difficult to say whether what an exposure X would have on humans. It's usually easier in animals to assess those differences. And then opportunity to obtain quantitative dose response data, not frequently done in human studies, but always usually done in high doses and animal studies. Human studies may not provide data on both sexes or on all relevant subgroups of the human population. So, the IR classification, this will probably be covered in toxicology, um, is an example of a hazard classification system. So it's mostly for carcinogens, or actually for carcinogens. It does not indicate risk, but there's a list of classifications that are available, and they list by the cancer types in sight. So when we look at IR monographs, we there's groupings that we look at. So group 1 are carcinogenic to humans. Group 2A probably carcinogenic to humans. Group 2B possibly carcinogenic to humans, and then group 3 not classifiable to carcinogenicity in humans. So we can see this is kind of like a more enhanced table with the same groupings and comparing human and experimental evidence. I'll leave this here for more of a reference. Another example of hazard identification is with WHMIS, which most of us should have completed prior to starting residency and or any sort of employment in the health facility. Should have completed WHMIS or a lab. It's implemented through coordinated federal, provincial, and territorial legislation. There's three components: product labeling, material safety data sheets, and the training aspects. In WHMIS, they list the hazards, precautions, and the first aid measures. And this indicates availability of MSDS, which includes details on the hazards, how to handle it, what to do in an emergency, and there's more resources available at some of those links that I've provided. So, as we have learned in WHMIS, some of these symbols are, there's more than two, but these are just some examples of some hazard symbols that they usually have. And I'll leave that here. More examples of symbols like the flame, exploding, gas cylinder, health hazard, exclamation mark, environment. And then the last one down here, we probably see this very often: biohazardous material, infectious materials. So on these material safety data sheets, they should include human health data, and this includes the routes of entry, and then the human effects and symptoms of overexposure, acute effects of exposure, and the chronic effects of exposure. So as mentioned, with these MSDS sheets, they have some high standards. They should include a company's identifying factors, some product information, chemical and physical data, fire, explosion hazards, reactivity data, toxicological properties, preventive measures, emergency and first aid procedures, and handling and storage. Okay, so moving into the second step, which is dose response. So the purpose of this second step is to calculate, if possible, the dose at which a harmful effect will occur. So in an occupational setting, for example, this is addressed through occupational exposure limits, OELs, and their legislated exposure benchmarks that grossly oversimplify dose response relationships. So most North American jurisdictions rely on the American College of Government Industrial Hygienists threshold limit values, TLVs, for airborne chemical substances. So TLVs, the definition is airborne concentration of chemical substances below which nearly all workers may be repeatedly exposed day after day over a working lifetime without adverse health effects. There's three categories: time-weighted average, average concentration over 8-hour workday in a 40-hour work week. There's the short-term exposure limit, which is 15 minutes time-weighted average that should not be exceeded. And then there's the ceiling, which is concentration that should not be exceeded during any part of a workday. So this is mostly for workers in a workplace, for example. And then they also have some guidelines. Are the threshold limit values up to date? Are activities in the workshop fairly heavy? Is inhalation the only route of exposure? Do people work an 8-hour day, 40 hours a week? Any other exposures in the workshop? Any similar exposures outside the workplace? And are some workers potentially more susceptible? So these are some examples. These might be covered more in the toxicology unit, along with this section on exposure assessment. So this is the third step, and it aims to identify the affected population and, if possible, calculate the amount, frequency, length of time, and route of exposure. So the exposure assessment includes the route, which is inhalation, skin absorption, ingestion, the amount, which is workplace measurements, frequency and duration, and the exposure is often based on how much, how often, how long. So exposure and exposure pathways. The exposure is a contact between an agent and the visible exterior of a person, examples being the skin and openings to the body. And the exposure pathway is the source of the agent or contaminant, an environmental media, what the agent travels through in the environment. So this could be air, water bodies, soil, dust, vegetation. The point of exposure, the receptor person or population, and the exposure route. So this is through ingestion, dermal exposure, and inhalation. So here's some examples of the exposure and exposure pathways. So there's the gaseous effluents, there's the deposition to crops, deposition to the ground, there's the irrigation, eating the crops by the animals, ingestion, which can become meat, and drinking milk for humans, exposure to deposited material, inhalation and transpiration, air submersion can still go to a human. And then in the background, you can see like a nuclear plant, some direct radiation. There's liquid effluents that can get into the drinking groundwater and the drinking surface water that can affect humans. So kind of like all these pathways are submerging on humans. So the exposure assessment, measuring or estimating the future or past human exposure to an environmental agent. So considerations here are the magnitude, frequency, duration, acute versus chronic, size, nature, type of human populations exposed, exposure routes, uncertainties, and then the direct measurement versus indirect. So this is the estimation modeling kind of thing. So this is quantification through one or more the point of contact measurement, scenario evaluation, and reconstruction from internal indicators and biomarkers. So the methods here include the range of accuracy, cost, indirect estimation or modeling. This can include questionnaires, imputation models, fixed source exposure monitoring, and then through direct measurements, continuous personal exposure monitoring, and biomarkers. So over here, we would consider the purpose of the exposure assessment to help determine which methods are most appropriate. So workplace measurements, most commonly measurements of airborne concentrations. They allow the direct comparison to the threshold limit values, estimate of inhalation exposures, personal sampling, area sampling, And then dermal exposure can also be significant. Improper gloves, soiled clothes, no hand washing or shower facilities, contamination. And then there's no consensus on dermal exposure assessment and measurement. So I wanted to add here also, there's some other terms along with these threshold limit values that we explained in dose response. Um, there's the NOEL and the LOEL, so they include the no observed adverse effect level and the lowest observed adverse effect level. So these are mostly, when you hear these terms, these are mostly in regards to like a substance or exposure and the amount of which is needed to acquire that effect. And they're often produced on a graph. I didn't want to get into that too much because there's complicated formulas with that, and that will probably be covered in the toxicology section. So, exposure specific medical surveillance. This is also part of a hazard prevention program. This includes the purpose evaluation of exposure via all routes of exposure, the total body, workplace and non-workplace, and they measure chemical or metabolites in biological media, usually the blood or the urine. And early detection of possible adverse effects. So proteinuria and cadmium exposed individuals to detect early nephrotoxicity, and beryllium lymphocyte proliferation test to detect beryllium sensitization. So some benchmarks. So the biological exposure index, the BEIs, represent the level of determinants that are most likely to be observed in specimens from healthy workers who have been exposed to chemicals to the same extent as workers with inhalation exposure at the threshold limit values. And the BEI generally indicates a concentration below which nearly all workers should not experience adverse health effects. The last step of the risk assessment before going into control is the risk characterization. So, this fourth step is a risk assessment for the determination of actual risks of a particular exposure to human health and well being, and it results in risk prioritization. So, this is based on the hazard appreciation of dose response, so the degree of harm, exposure, the route intensity, frequency, duration, vulnerability, individuals exposed, work environment, systems used, and it seeks to answer what is the potential risk to the health and is action required to reduce that risk. So, if you're in a workplace, the walkthrough would include the hazards, exposure, and controls, right? So, first you would want to observe. This would be including task and process, so timing, demands, and the materials used. Number two, the equipment, vehicles, tools, personal protective equipment. Number three, the environment, ambient conditions, odor, noise, bystander exposures, housekeeping, general safety measures, protective barriers, ventilation. And lastly, workers. This could include the number, shift, experience, training, susceptibility, eating areas, rest areas. So we want to observe the work and document. So risk rating, based off, there's various templates, tools, and matrices that exist. This is based on likelihood of exposure and the severity of the impact or consequence. So you might see this diagram in table 1, which is a risk matrix, which includes probability and severity. And you can note the colors in here, which are useful. So the colors kind of indicate the urgency or the level of response. So you can see in this diagram, the severity ratings in the example represent high, so high probability, high severity, major fracture, poisoning, significant loss of blood, serious head injury, fatal disease. Mediums would be strains, localized burns, dermatitis, asthma, injury, requiring days off of work. And then low would be an injury that requires first aid only, short term pain, irritation, or dizziness. So I'm just going back to this. This is mostly used in like injury prevention type of measures. So you can see most of these examples are injury related. And then in table 2, it is based off the colors that we've seen in table 1. So red, of course, indicates immediately dangerous, and then as we go down in the color scale, or bright orange, and then brighter orange, yellow, so higher, medium, low, and low, very low risk. So if it's immediately dangerous, we want to stop the process and implement controls. If it's high risk, you want to investigate the process and implement controls immediately. If it's medium risk, you want to keep the process going. However, a control plan must be developed and should be implemented as soon as possible. And if it's low risk, you want to keep the process going but monitor regularly. And a control plan should also be investigated. And if it's very low risk, you want to keep monitoring the process. So when we put that whole risk assessment that we've talked about in the 4 steps, this is kind of like a framework that when you make it as like a flow diagram kind of thing, where you have research on one end, risk assessment, and then risk management down here. So when we look at the steps in the risk assessment, the hazard identification, dose response assessment, exposure assessment, and risk characterization. So in terms of like research, we see it down here, and laboratory and field measurements of exposure, evaluation of exposed populations, and observations of adverse effects. And some of the work from risk assessment could inform research need, new mechanistic understanding of toxicity, and some of this research, like genomic information, can inform the risk assessment. So, we can use work over here on the left side of the screen to inform some of the risk management things, so that can inform policy decisions and actions, development of regulatory options, evaluation of public health, economic, social, political context for risk management options. Okay, I'm going to stop here before going into the control models strategy section. So I'll see you back in the next video.